I'm
Good to see
okay.
you, Prince. So
Hey, how you been?
yeah. Okay, so we'll go over a few questions today, and
Okay.
I'm very excited actually to interview on these various topics of interest. So let's just start by uh, about you. So tell me about yourself.
Hi everyone. Hey, Yubin again.
Yeah.
My name is Prince Baawuah, and I originally from Ghana, but I came to the US and right to high school in Ghana, and I've been in the US. Um, Background in economics, public health, and health informatics, working in healthcare. Healthcare has been a place that I have always desired to be, and it's good to be here, learning more and seeing how best I can use my interest and my passion to drive equitable healthcare to many. So that is just a little just about who I am and yeah, my interest that I have in healthcare.
Yeah. The what would you say who you are in one sentence? Have you thought about it? Yeah.
That's a very good question. Who am
Yeah.
I in 1 seconds?
Yeah.
Uh,
One sentence. Yeah, one or two sentences. Yeah, yeah.
um,
Yeah. Who are you?
uh, that's a difficult question.
Yeah.
I,
Hmm.
huh, that's a difficult question. Who am I
Yeah.
in a sentence?
Yeah.
I am
Any
Prince.
particular word that describe you? Yeah. What do you think?
Oh,
Yeah. Hmm.
enthusiasm.
Yeah. Enthusiasm, healthcare,
Yeah,
health.
and I think yeah, I have passion and I come with some energy, some enthusiasm in things that I do. So I
Yeah.
think yeah, and enthusiasm will be a good defining word.
What is the topic or subject that you're enthusiastic about it? Yeah.
I pretty much when I see lives transformed, in a better way, I really get excited about that.
Mm-hmm.
So when I see that lives transform from where it was to a different level, I really get excited about that.
Mm-hmm.
So
Is that why you're excited about healthcare? Because you see a lot of our lives changing? Yeah.
that is yeah, it gets me there. Yeah.
Yeah.
Yeah, yeah.
Mhm.
So lives when I see lives transformed, I get really excited. So
Yeah.
yeah.
So what do you do? So what do you do for a living?
Currently, I do a lot of training. I do training in Medicare Advantage risk adjustment. That is my background. So, and I work in data. I have a degree in health informatics. So, how data is being used and leveraged to make sure those that need that data, that information, to make it the decision that they need to make, excites me. So, I do training on data, transforming that into information and mostly in the risk adjustment, Medicare Advantage risk adjustment space. So that's what I currently do.
I see. So coming back to the kind of first question again, Prince. Yeah.
Sure.
Does that actually change kind of what you think about who you are, kind of based on the what you do and currently and the what you are excited about? Yeah. So yeah.
Do you mind saying it again? Sorry.
Yeah. So kind of based on the kind of what you just described, kind of how would you summarize about you? Yeah.
So, I would say I am an individual that gets excited
Yeah.
about seeing lives transformed and the transformation coming from knowing the right information they know to make the right decision, and
Mhm.
then that transforming their life from one place to another. So probably just answered your question.
Yeah.
Thank you for helping me do
Oh, yeah.
that.
So do you use publicly available data sources a lot? Yeah, for your work.
Yes, definitely. I do use publicly available data. In Medicare Advantage, a lot of the data is published online, either from operations
Mhm.
or from analytics. And the Medicare Advantage plans data is also enrollment, benefits, things like that are published online.
Yeah.
So I leverage those ones to do my work.
Mhm.
So I always get excited about that when I'm using publicly available data in a way that makes it easier for people to transform lives. So
Yeah. So yeah, what's good and bad about these data sets that you use? Yeah. So yeah, what do you like about it and what do you don't like about it? Yeah.
Yeah, I think one framework that helps me in looking at, and it's not only data, but any product are making sure it's useful and usable, right?
Yeah.
So as I bring that same passion to and that same framework to publicly available data, I'm looking at it two things. Is it useful? Is it usable? If it's useful but not usable, then people like it's very difficult for people to use it, and therefore it's hard for them to use it.
Hmm.
But if it's usable, and not useful, then it becomes like a toy, you know. It's
Hmm.
like playing with it. But ultimately, you want it to be useful and usable. And I see that in publicly available data, where there might be much more data or information that can be garnered from it, but it's not usable. So it becomes very difficult for people to know even if it's useful to get information from that. So ultimately, if publicly available data gets to that quadrant of useful and usable, I think there will be a lot of power to use it to transform lives.
That's actually a good framework of thinking. Is it something you invented, useful and usable?
Yes, when I was in actually when I was a contractor officer representative, and I was working on some of the encounter data
Mhm.
analytic platform, and that was the framework that as a core and a technical lead,
Mhm.
a simple one that could help that helped us to be able to develop the application in that way. So looking at that from that perspective was very easier for us to see that framework and what quadrant where we are in
Mhm.
terms of its usability and usefulness scale to
Mhm.
help us do the work.
I see. So the usability actually may depend on the audience to some degree,
Yes.
and the usefulness as well. So the
Yeah.
currently, among the data sets you use, uh, can you elaborate a bit more? Some public data set you use, you think those are useful for someone, but they are not usable for someone, or kind of usable for someone, but they're not usable for the other one.
The other
can
one.
you get some example? Yeah, on that. Yeah,
That is thank you for
yeah,
that. And
yeah,
one work that I've done as I'm using the Mimilabs
yeah,
as the but looking at the benefits data.
yeah. Mm-hmm.
This was my first time looking at benefits data.
Mm-hmm.
And not only did I look at it to develop to understand what is in there,
Mm-hmm.
but also I because I also love to teach, I took somebody along and tried to teach them through it. And we're in healthcare. Health managed care comes with health benefits.
Mm-hmm.
It's always good to know what benefits you have, right? Many times you probably signed up from through a broker, and I'm talking to this through the Medicare standpoint. But even in our regular day, like if you are employed, your employer group have probably has some medical benefits that you're looking at. They'll have a summary form. In understanding what benefits you need, right? It's called benefits, but the need is different from everyone, and that may be the reason why there are several benefits plans.
Mm-hmm.
Um, in looking at that, for example, looking at transportation, and the transportation actually came to be from inspired by my wife and I went to Ghana this year, and she got really sick, and we needed to get her to the hospital.
In Ghana.
But get in Ghana, yeah.
Mhm.
But getting the transportation, we had a car, but the roads were not good. But we needed to get her there. So it made me start to rethink about the power of transportation and getting access. And I think it ultimately gets to access. Um, and the power of that to save lives, it's not about the medical care, it was just the transportation and the road to get there and seeing how important it is. It made me go back to look at what are some of the transportation issues that we see here in the US and people getting access to transportation, either for specialists or primary care, and
Yeah.
even to non-medical medical benefits. So for that, for example, if someone is a broker and they are signing somebody up, understanding that, hey, this benefits plan package or benefit plan package, yeah, has transportation, it helps the broker to know which beneficiaries they need to sign them up for what service they need, right? So that data at that point in time is useful for a broker, but if the data is set up, although the data might be publicly available, but it's not set up in a way that helps the broker better understand all the benefits that are there to better help the patient, then it's not usable in that way. I hope I'm making sense,
No, no,
right?
it makes sense.
So
Yeah, yeah, yeah.
yeah.
So the
So as a
mhm.
go
Oh,
ahead.
go on. Yeah.
Yeah. So at that point in time, either the data is the broker needs the data. So it's useful for the broker, but it's not in a usable form for the broker or the agent to help the patient. Then although the data might be publicly available, it's not, and it's a useful data for the broker, but it's not usable for that broker at that point in time in making a decision. So that's one example, if that makes sense.
Let's go down a little bit technical about that topic. So the why do you think actually not usable at this point? So the is it just the data itself is too complex? So the is it something that the needs a lot of kind of domain knowledge and interpretation, or is it just more technically complicated at the moment? Yeah,
I think you can see
yeah,
the two avenues, and technically complicated is dependent on the person, right?
that's true.
Um,
Yeah.
that there is the domain knowledge in healthcare.
Yeah.
I'm thankful that at least I've been in healthcare in a while to understand some of
Yeah.
these things. So I can look at the even if the data is technically complex,
Mhm.
um, I may be able to have the domain knowledge,
Mhm.
but without the data skills, right, or the data infrastructure platform,
Mhm.
it doesn't serve me anything because I'll look at the data and I was like, okay, this is too, it may have a data dictionary, but I was like, okay, I don't have the platform or I don't have the knowledge
Mhm.
on the platform to be able to get the data into a useful state, right? Or yeah, usable state, I mean.
Mhm.
Someone who has the technical technology-wise systems can put the data together in an easy way, which the Mimilabs team is doing. But then someone without domain knowledge will also not get in, or they may get in and create something, but it's not given the useful knowledge, the information that is needed in that point in time. So you need a
Yeah.
combination of the domain knowledge, you need a combination of understanding the how to pull the data together in an easy way, and you need the understanding of how to analyze the data to get to the information that the business people need at that point in time to make decisions. So I think it's a continuum of all of them that I needed.
No, that's actually a very you know elaborately spoken. So the it seems kind of the usability is kind of there is a gap in usability between the technical complexity and the domain knowledge, and there needs
Yes,
to be some place actually those things can be met. While
met
kind of
together.
reach. Yeah.
And
So
and I also want to add
yeah.
on to the business side, right?
Mm,
You may have the domain
yeah.
knowledge, you may have the technical, and you may want to know the questions that
Mhm.
at that point in time that they are asking so that you are able to pull it in a way that makes it easier for those that needs to make decision at that point in time,
Yeah.
to make it easy for them.
That's yeah, I agree. I agree. So the regarding the benefits data that you looked into, and I believe you talked to some of the brokers, kind of, or maybe some patients as well. What do you think we can do better to actually, have them informed while educated on these topics? That there are so much other data that actually they can access, or kind of. So the kind of maybe I rephrase my question. Do they actually feel these data are useful for them? Kind of just kind of based on your feeling? Yeah.
Yeah, I think, and I wouldn't talk more of my feeling. I maybe, yeah, just per what I've talked, interacted with some brokers,
Yeah,
and I've asked them question like, how do you even help you know what plans your beneficiary may
yeah,
need,
yeah,
right? Many of them, at least for those that I've talked to, will say, I just have a spreadsheet and I'm collecting this
yeah,
information and I put them in every time, and I don't understand. I'm only taking training on my the specific plans that I'll be selling, but the data is there, right? The data is there for all the benefit packages, regardless of the plan that you are selling or not.
Mm.
But as a broker can, for example, as a broker, can you, knowing the population that you're dealing with, can you now go back to the benefits data, get a better understanding of where your beneficiaries need, and therefore knowing more about the plan, which benefit packages provide.
Mm.
Now you can go back and look at which specific parent organizations you need to deal with instead
Mm.
of the other way. I don't know if I'm making sense.
Mm. Yeah,
Now,
yeah,
I
yeah,
wonder what they do. Like, did they just go and select, okay, I want to work with plan A, plan B, plan C, and then they go back, all right, this is what I'm selling. But if they can rethink it, know the beneficiaries you're dealing with,
yeah. Yep.
understand the benefits pack, all the benefit packages, and therefore that determine which plans that you work with that can help serve the beneficiaries. I think that's a different way of thinking through because when you
Yeah.
are taking training for only the parent orgs that you are selling, you are limited, but you understand the entire ecosystem of benefits, then you can now choose, knowing your beneficiaries need, you can choose which plans to work with. And
It's a
that
very
can be a different method. Yeah,
yeah, interesting idea. So the current ecosystem, brokers work from the planned perspective, and they actually understand the benefits from the parent organizations, and they explain that to beneficiaries.
sure. Yeah.
But I think to some degree, brokers already know about you know uh, who they are serving, their beneficiaries, and maybe it's time to go back reverse. Based on their understanding about the
Yeah.
beneficiaries. I think they may actually need to choose which plan is actually most appropriate to serve their beneficiaries. Yeah, so
Beneficiaries.
yeah, 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 yeah. It's
Yeah.
yeah, interesting way to reverse the paradigm, I guess. Yeah, yeah,
Yeah, because
yeah,
ultimately it goes
yeah,
back to that transform life as a
mm,
broker or as an individual, even
yeah,
provider.
mm,
Like, and for me specifically, I want to make sure that whoever I'm serving's life gets transformed. Even if I'm teaching, I'm educating, their lives gets transformed. So that brings me the excitement, as we talked about initially, that excitement knowing that I was able to match the patient's need to what the packages they are because it's supposed to be a benefit package, so it has to benefit them,
yeah.
right?
That's right. Yeah.
So ultimately, when I see that at least for
Mm,
me, that
yeah.
is what continuously makes me excited about.
Yeah, very true. So let's move on to the next topic. So what should governments do to more? I mean to promote the use of a public data sets. So the what can they do? What can governments can do uh, to increase the usefulness or usability? Yeah.
Yeah, I had the privilege to serve as a fellow
Mm.
at the Executive Office of the President in the Federal Data Strategy for
Yeah.
2021, 2022. Yeah. So I had a privilege because the Federal Data Strategy was one way that the government can, across government, can leverage the data,
Mm.
the publicly available data sets, telling or informing governmental agencies
Yeah.
to make sure they have chief data officers. And there were a lot of strategies and action plans that were pertaining to it. So that's one way,
Mm.
because if the data is there, but it's locked up or people
Yeah.
do not know or people do not understand, then it doesn't ultimately get the purpose. And one program that I saw, which I hadn't learned before until then, was the Opportunity Project. The Opportunity Project was a way that um, I think it was for Sprint. The government agency will have people from the industry, and the government agency will give us me a subject matter expertise out to the industry, and with a public data set that is there, they through a sprint they are able to develop a project out of it. So
Mm.
it was sometimes the most of the data sets that are put out requires domain knowledge. We just talked about it, but
Yeah.
it mostly the domain knowledge comes from federal agencies, SMEs, right? So this was a combination of the SME from the federal agency working with an industry person,
Mhm.
and on the sprint on some of our data that are out there. I think during COVID, there were several other projects that were being put out together to help different communities to get back up after COVID. So that is, I think, and when I first learned about the Opportunity Project, I was very excited about it. I don't know how, if it's still ongoing, but I thought that was a way to let the industry know that this data sets are available and
Mhm.
then gives the subject matter experts from the governmental agency to help with the industry to help develop something that can be impactful to a community. So the Opportunity Project I thought was a phenomenal avenue for that.
I see. So do you think actually government should try to do more of those? Yeah, I mean, to some degree, now we both are outside of the government.
As- Yeah, I think the government is already doing, yeah,
Yeah,
is doing fantastic job,
yeah.
right? I think ultimately to do more, is it the more that is beneficial? Definitely.
Mm,
More that is not beneficial, definitely not.
mm,
You know, but so should there be improvement from what is currently is? I think there is always room for improvement, definitely.
mm,
But if the government should do more that is not beneficial, then definitely not, you know. So definitely there's room for improvement in getting data out there, letting people know that this data is out there,
mm,
providing the necessary metadata to help understand and putting the data in a more usable and useful, or at least in a way that doesn't require as much, as easy as possible for users to use it.
yeah,
That makes it easier for the learning curve. And even if there are some domain knowledge areas that can be added on to help
mm,
people understand the
yeah,
data much more, I think
yeah.
that would be fantastic as well.
Would that be something private sector can help out as well? Just making the data more usable or more accessible. So what do you think actually what do you think of the private sector's role in making these public data sets more usable while useful? Yeah.
Hey, you just asked the question. I know all the benefits data that I'm doing is
Yeah,
because
yeah.
Mimilabs team has
Yeah.
been pulling this together, and this is a testimony, right?
Mhm.
So your team, the Mimilab team, pull it together in a more in a easily accessible way.
Mhm.
Guess what? I am also a private citizen, right?
Mm.
I'm talking about benefits data. I based on my knowledge that I have, I got into the platform and developed some of these things. So these are all of them are, the government put it out there. The Mimi Labs team put it together in a way. I come in, or other people that are leveraging the Mimi Labs came in, and also based on their expertise, also making sure that, for example, the benefits data, if it's the brokers or it's the beneficiaries that benefit from it, it gets to them. So
Mhm.
this is an entire ecosystem of the federal and the private citizens or private companies all working together to make sure that at the end of the day, lives are transformed in
Mm.
that way.
Yeah. Coming
And
back to your
that's a prime example of this.
we both are going to attend this Health Datapalooza 2020.
I'm excited for
Yeah,
that.
yeah. What are you most excited about attending this
I
event?
think
Yeah.
the opportunity to meet people,
Mm,
to learn, the opportunity to understand what is going on either from academic research and data that is out there, and how the academic research is not like having a doctoral degree. Sometimes some of the academic research
mhm,
doesn't the time it takes from that knowledge get trickling down to the industry to be useful may be long, but understanding how these data sets can ultimately be useful to the end user, it gets exciting. One area that I'm excited to understand and learn, I know the HHS will be telling more about their data strategy, which, as I said, I had worked earlier on the federal data strategy, like understanding where that has evolved to across HHS will be exciting to I'm very excited for that. So that's one thing I look forward to.
I'll pay my attention to that too. So
Hey, if you're in healthcare, HHS
yeah,
data and their strategy is one way that you want to make sure the data makes it to the end users.
yeah. Interesting. So anything you wanna add? So can we cover the most of the topics today? Yeah, it was.
No, I think it's a very exciting time because
Uh,
data technology has evolved so much,
mhm,
right? And then there is a lot of data out there. So making data informed decisions or getting data to the hands of those that are making decisions at a point in time or even before the point in time so that they have the knowledge, they have the information, they have the knowledge, they have the wisdom that they need to make decision at a point in time. I think if I look back maybe 10 years since I've been in healthcare, I think we've done a lot of work. There's still a lot of work to be done, but I think we are better off from prior. And I think it's exciting to see where we continue to grow and evolve. And we work collaboratively in making that happen, ultimately for the transformation of patients, which we all are.
Yeah, yeah.
Ultimately, we are all patients, so for transformation of our lives.
That's right. We are all patients. It's unavoidable.
Even before we are born, we are patients.